Mental health problems in childhood and adolescence are very common. It's probable that 10% of young people have some kind of mental health problem, maybe even more. But the thing that's so important is that they don't just affect one's childhood, they affect the rest of one's life. And the reason that we wanted to look at this and to study what the implications were was to see what those effects were on people's later life. What we've used is 3 birth cohort studies. It's interesting that one of the very best things that's available to social scientists in the UK is that we have a tradition of following birth cohorts since 1946 through to 1958 and through 1970. And in fact, there is a later one, a millennium birth cohort. And I think for people who've seen programmes like 7up, they will know how important it is to be able to look back at what we knew about children when they were born, as they grew up, then finding out what happens to them in later life. Using the 3 birth cohorts that we have for this study, what we found is that it is not so much people's mental health that's affected in later life by early childhood problems with mental health, but it's actually all of their life chances. So if you have particular problems as a child, you're going to have problems in many spheres of your life. They may be about employment, they may be about being involved in crime, offending behaviour, divorce, low educational attainment and so forth. So what we wanted to do was to just look in some detail and see what those effects were. What we found is that the particular problems are associated with what are called conduct disorders. And that's really just as it's described. In young children and in adolescents, if people have either mild or very serious conduct disorder, often it comes to light in school, maybe as early as nursery school, but in school that the child's behaviour is seen to be out with that of its colleagues. What can happen is that if those conduct problems are not dealt with and not dealt with effectively, then what happens in later life can be directly related to that. So just looking at the study, for instance, people with mild conduct problems were twice as likely as other people to have no educational qualifications. But severe conduct problems, it was maybe 4 times as much. So you see immediately that untreated difficulties with conduct disorder have effects on your educational level for the rest of your life. People with both mild and severe conduct problems have a much higher rate of what we've called economic inactivity. And I think what we mean here is not just that they sometimes don't have a job, but that they have sustained periods of not being able to find and keep work. And that's not related to, particularly now, to times of economic hardship, but is at all times, whether there are high levels of employment or lower levels, those folk who've had conduct problems in early life will have trouble finding and keeping work. Some of the things that probably surprised us a bit more were that conduct problems are associated with women never marrying, both for men and women, divorce and teenage parenthood. So again, these early problems with conduct disorder, mental health difficulties, become entwined with a number of the difficulties that we worry about in young people and young adults. And finally, and I think very importantly for Sainsbury Centre, and our particular interest in offenders, in criminal justice, people with severe conduct problems were 4 times more likely to have been arrested in early adulthood and 3 times more likely to have been convicted in court. So that's the picture we found. It sadly confirms a number of theories that people have had. We've been able to use these terrific studies that have gone on over the years. If you think about people born in 1946, they're in their 60s now. We have a pretty good picture of what's happened in their lives. Equally the people born in 1958 and increasingly the people born in 1970. So we have this clear picture. So what's to be done? Because I don't think what we want to do is only say there are these problems. What we now need to do, and I think it's a very strong piece of our work in Sainsbury's Centre, is to say it clearly matters if people have these problems. It is important that they are supported and treated. And therefore what we need now is for government, for local authorities, for health authorities, commissioners and providers to really address carefully what kind of support and intervention they're giving, not just to young people, but also to their families. So this is very much concerned with support for families and children. Now, there have been some discussions about whether early interventions like Sure Start and so on have quite got the evidence to support their effectiveness. But I think what we do know is that sustained interventions with young children and with their families would be extremely important in improving the life chances of our citizens, our fellow citizens. And actually, they would be good sense in a business way as well. We should not be spending large amounts of money keeping some of our fellow citizens out of work, in prison even, when by intervening early and investing now, we could improve people's life chances.